Gang, what's up? Aaron here. Ever have a really bad hair day? You're gonna see 3 women from the Liberal Party, a couple of ministers, and HESA Fry. They're having bad hair days. This is the most ridiculous committee meeting that I've seen this session. This is a new one. Get ready. If you don't know who HESA Fry is, you won't forget her after this. Same goes for Marjorie Mitchell, the health minister, and Lena Diab, immigration minister. These women are out of their league. Let's take a peek. This one gets heated by the end. Let's check this out. These ladies are a lot to handle. Let's take a look.
Hey, that's something everyone can enjoy.
Just before the clock starts.
I shall begin, pardon?
Just before the clock starts.
Is it a point of order, Mr. Major?
Just a point of clarification. Both ministers can be here for the full 2 hours?
Yes.
Up to 1 o'clock.
Yes,
Perfect.
I sent you a note saying that, Mr. Major.
Things changed. I just want to get confirmation. Thank you very much.
Okay, so we begin. For 6 minutes, please, Mr. Major from the Conservatives.
Thank you, Chair, and thank you, ministers, for coming here today. Who is responsible for ensuring that immigration levels match healthcare capacity? Is it you, Minister Diab, or Minister Michelle?
So certainly as the Minister of Immigration, Refugees and Citizenship, my role hopefully is sort of clear and understood by now, and it is to manage our immigration system by, we just put a levels plan together, which is something that is done on a yearly basis, that we have targets for permanent residents, temporary residents. We now have an attraction strategy and francophone targets.
But who is responsible for the immigration levels to match healthcare capacity? Is it either one of you?
Okay, so the way it works is immigration is a shared provincial, territorial,
Yes
federal
or no?
jurisdiction. And so we work with the provinces and territories with respect to that.
Minister Diab, do you consider Canada's existing healthcare capacity before setting federal immigration levels?
So we have extensive consultations that happen. I personally did some as well all summer long. And part of that, those takes in stakeholders from the healthcare sector.
You do consider it?
Of course, everything is considered.
How many more patients can our healthcare system handle this year, according to your department's analysis?
Oh, that's not a fair question for immigration.
But, Minister, you just said you do consider it, so you must do some analysis.
So what I said is we have extensive consultations that occurs on a yearly basis when we set our target levels for permanent residency and temporary residency, and we take all the stakeholders' views, most importantly provinces, territories, municipal partners, economists, and and everyone in the many different industry stakeholders.
Do you know if your department does this analysis? Does the analysis for the immigration levels?
A lot of our the information that we get related to the healthcare system is in fact in working closely with the provinces.
So you do analysis, or you don't?
We ask capacity questions to our provincial counterparts. They provide some of that information to us. What we did hear overwhelmingly during our consultations that people were looking to use immigration to bring in healthcare workers.
So you don't know how many more patients can be served according to your any more? You don't have any analysis of that, of how many more patients can be served due to immigration?
So again, the answer is pretty clear from my part. The extensive consultation we've done from many across the country was the question that was raised is how can IRCC facilitate and open pathways and work with provinces and territories to bring in healthcare workers.
We'll get on to the next question.
Will you allow the witness to answer the question?
She wasn't answing. So
well, that's not your decision.
And then she took
to
a new
make.
question. So that's
Witnesses
okay.
can answer how they choose. Thank you.
Minister Diab, how many Canadians don't have access to a family doctor in Canada right now?
I'm going to turn that over to the healthcare, but again, that's a provincial. I come from Nova Scotia. These are tracked, and I used to be a provincial member of the legislature and a provincial minister. Those numbers are tracked provincially, territorially. I believe the committee knows that, and I think most Canadians do.
So you know, though?
Well, I'm a federal minister, and
you don't know?
I can
Correct?
go on the websites and check for
Okay.
you if you'd like.
Minister Michelle, how many Canadians don't have access to a family doctor right now? Just the number, please. Minister Michelle, I'm asking you.
5.7, 6 million, around 6 million people. Around 6 million, 5.7, exactly.
The government plans to admit over 450,000 permanent residents into Canada this year. Can you confirm that every newcomer admitted under the immigration plan will have access to a family doctor upon arrival? Yes or no?
So the number's not accurate. Our 2025 permanent residence number is 325,000. But do you mind asking your question again?
Can you confirm if every newcomer admitted under your immigration plan will have access to a family doctor upon arrival? Yes or no?
So many that are arriving are doctors and physicians and clinicians and nurses and healthcare providers themselves who are actually here to service Canadians.
Minister Diab, are you aware that
47 seconds.
Are you aware that Canada's population is growing faster than the supply of family doctors? Yes or no?
Well, we have 41 million plus in population. I'm pretty sure we don't have 41 million doctors.
It's the supply of family doctors. So in other words, you are immigrating more people than there are family doctors to be able to serve Canadians.
We can ask the analysts about that, the stats on that.
So when the population grows faster than the number of family doctors, access to care gets worse. Can you agree on that?
You've got 5 seconds
I
left.
think it depends on people's age and health and so on. I mean, I've been to many countries around the globe where
So
it's not a question of a
can't agree with
doctor
that.
to, there's a lot of collaborative care centers as well.
Thank you, Minister.
I'd like the members of the committee to please remember that when you ask a question, you should allow for the answer. Thank you.
Oh, yeah.
I now go to another round, and we begin another 5-minute round, starting with Ms. Conants for the Conservatives. 5 minutes, please, Ms. Conants.
Chair, we got cut off, unfortunately, during my last question round, and I just wanted to ask Minister Michelle, the Foreign Credential Recognition Action Fund in the budget says it will be run with a focus on health. It will cost taxpayers $97 million over 5 years. What is the per target of medical credentials you intend this fund to recognize? Just a number.
Sorry. So what you need to understand is that program, yes, it's for health, but it's developed by ESDC, and it's a new funding.
So do you know how many people will be credentialed?
Still foreign recognition.
If a question is asked, a witness should be allowed to answer, please. It's just simple respect. Thank you. Ms.
Yeah, just
Minister?
a number if you happen to have one. Just because I know it's a focus on health, and it's obviously important to the entire country, this foreign credential recognition. We need
Yes.
doctors. So how many doctors will that allow to practice?
So as I said, this funding is going under ESDC, even if we are talking about health. And ESDC is now working on it and putting, they are developing targets. What I did, and I said it already, is I spoke with my counterparts, all the Minister of Health. Excuse me?
Sorry to interrupt, but how much of this will go towards credential recognition for doctors and medical profession? What percentage of the 97
The
million?
minister is trying to answer the question, Ms. Conants.
I'm asking
Will you allow
for a
her?
number. I don't have much time, Chair, and
That's
I
true.
want to ask if you have a number, because
I already told you.
You
She's
obviously
explaining.
have.
Yes, I already told you the program is designed by
Oh, I'm
ESDC,
sorry, what is the number? I
and they
missed
are
it.
developing targets now.
So
we
how do you
just
know-
got the $97 million.
Okay,
so
97
ESDC
We still have a vote tonight, too.
and we still have a vote tonight.
So there will be
and again,
one doctor credentialed, 300? You don't know?
You got your answer.
Oh, okay. All right. Dr. Strauss, I will cede the rest of my time to you. Thank you.
Thank you, Chair. Minister Diab.
Excuse me. Thank you, Mr. Strauss. Go ahead.
Thank you, Chair. Minister Diab, I had to check. I mean, we all know you as the Minister of Immigration, but you are the Minister of Refugees as well. And so I guess I was dumbfounded when you said that you don't know what % of refugee claims are ultimately accepted in the last round.
I do not. I can go on the website and check, and I'm sure
Maybe you should.
colleagues can do that. We can definitely follow up with you.
Okay, I mean, that was 20 minutes ago. When somebody's refugee claim is denied, do they continue to receive benefits from IFHP?
No, when it's denied, it follows through the process. Once the process is concluded, it ends.
Okay, and then just turning to the visa trainee issue, do you understand how there's a difference between capacity and funding? So if there's an OR and there's a professor of anesthesia in the OR, he can take a trainee. That trainee can either be from Saudi Arabia or it could be a Canadian. So the funding might come from Saudi Arabia. Maybe we don't have the funding in Canada, but if the Saudi trainee is there, then the capacity to train someone exists in our system. So if the funds aren't there, don't you think, and this might be for Minister Michel, don't you think we should fund it? Like the capacity is there, the training spot is there, whether it's part of CARMS or it's not. Why don't we fund it instead of dictators in Saudi?
I'm going to turn you to the medical schools, I guess, in the provinces and territories. It's not something that IRCC
have the funding. You've got the bags of money. You're the federal government. And then last thing I want to say is, so you say you don't track, you bring doctors to this country. They expect to work here. You're bringing them here to serve Canadians, and then you don't track whether they actually become doctors or not. Like, I understand that you don't. You said you don't, but shouldn't you? Like,
I know
why
from
don't you
another
do it?
hat that I wore in the province, the provinces tracked the doctors. So I can say to you, the provinces and territories probably do, because I used to as a minister provincially, but it's not something IRCC tracked.
But you're the
that
one
is
in
not
charge
the,
of
that
bringing
is
them
not,
in.
not the role.
So this committee heard from a constituent of mine, Dr. Pantia Barati. She feels cheated by the Canadian immigration system because she was brought here to be a doctor. She's fully qualified. She flies to England to work every other month. Don't you feel any responsibility to her to figure out like why you brought her here when she couldn't obtain a license here, and you're just still giving out more of these immigration permits to thousands and thousands of doctors who aren't allowed to work?
Absolutely, because of reasons like that we are working hard to ensure these types of things do not happen. That is why we have the pre-arrival support services. That is why we put all information on. That is why we ask the individuals to clarify with licensing bodies and have the bodies work with them, as well as the employers at the hospital.
Excuse
Point of order, Madam Chair.
Order. I'm sorry. This is getting a little bit out of order. If a minister, if someone asks a question, you should not keep speaking while they're answering it. Please, just let's be a little bit respectful in this committee. Thank you. Go ahead, Minister. You are answering the question.
No, it's exactly things that you are referring to that we do not want to happen. And that is why we work extremely hard, whether it's the provincial or the federal, or, to ensure that people have the tools they need and the information they need so that we don't have these happen here. And when they do, yes, it is not.
Thank you, Minister. You're saying you're working hard.
Thank you. I'm sorry. Your time is well over. Mr. Strauss.
Oh, yeah.
We're going to wrap it up right there, gang. Aaron at Canadian Looney. Get your Canadian federal politics right here. We cover everything from the House of Commons to the committee meetings to the scrums to legacy media. We cover all the frontline politics. Get your information right here. Liberal voters, I would invite you to watch some of the frontline politics to learn what is really going on with our government. They're duping everybody. Aaron, Canadian Looney, thank you very much for watching this video. Watch one of the other ones floating around here. We'll catch you in the next one. Till next time, gang, we're out.